So I've been singing her this song. It goes, pink princess bed, I'm gonna keep on napping in my pink princess bed. I'm gonna keep on snacking on my tiny plush bread. I'm gonna keep on napping in my pink princess bed. Pink princess bed. Hi, Rhubarb! You wanna make a video?
Hey everyone, it's your friend Hannah, the kitten lady, and I am joined today by my new foster kitten, Rhubarb. Rhubarb is a 5-week-old kitten, and as you can see, unfortunately, Rhubarb has some significant damage to her eyes, and that's what we're gonna talk about today. We're gonna talk about eye infections in kittens, and specifically eye ulceration and rupture. A lot of people are surprised by just how often kittens get eye infections, but it's one of the most common medical conditions that we see. So Rhubarb came from a colony outdoors where she was living with a lot of other cats. And something that can happen when kittens are around a lot of other cats is they're exposed to pathogens in the environment, whether that's viruses, bacteria, fungus. And when you are a tiny kitten with an underdeveloped immune system, that means that you are much more susceptible to becoming ill. Kitten eye infections are very often caused by the herpes virus. It's a virus that is prevalent in the environment, and when they come from either a cat colony outside or they're exposed to herpes virus maybe in an animal shelter, they're unable to fight that off, and without treatment, they're often unable to cope with the damage that it can do. If you have a cat at home, they probably have received the FVRCP vaccine. That's a vaccine that includes protection against herpes virus. But for these little kittens who don't have any vaccination or are under-vaccinated, they don't have the protection against that. Now, the good news is if your kitten gets an eye infection and you take them to the vet right away, these are usually very treatable conditions. The bad news is, for a kitten like Rhubarb, who was living outdoors for the first 5 weeks of her life, that's enough time for significant damage to be done to her eyes. So here's what we're looking at with Rhubarb's eyes. Her right eye here is completely ruptured. Woo! So the ruptured globe can happen as the result of really ongoing ulceration that is not treated, that actually penetrates all the way through the cornea and causes permanent damage. That eye, unfortunately, will have to be removed through a surgery called enucleation. Her left eye is not yet ruptured, but it is definitely on its way there. She has a very misshapen globe, and there's a lot of pressure and scarring happening. Currently, she does not appear to have any vision in that eye, but we are hoping that we're going to be able to at least salvage the globe. She may have some ability to perceive light. It's possible she could have a little bit of vision back. We just are going to have to see how she responds to treatment. As you can see, even within the same kitten, the eyes can be very different. So it's important to know that if you have a kitten with an eye infection, you do actually need to go to a veterinarian who can tell you exactly what treatment is needed. If you are an animal rescuer, do not go putting any old medication you have around your house in your kitten's eyes, because there are actually medications that can make certain conditions much worse. For example, if the kitten has an ulcer, which is not always something you can perceive with your own 2 eyes, giving them a drug with a steroid in it can cause permanent damage. Unfortunately, in the case of Rhubarb, a well-meaning person did give her an eye drop that had a steroid in it. And steroids have a very important function for some cases, but in a case like hers, it actually slows the healing process. It allows herpes virus to replicate over and over again in the kitten. It can cause their recovery to slow or stop. Wow, what a scary thing to know, right? This is why I always say no 2 cases are exactly alike. Every single kitten needs to see a vet. So step 1 for Rhubarb was getting seen by a vet. What the veterinarian said is that her right eye is definitely beyond repair and is going to have to be removed, but that her left eye is worth trying for. And so she's on a series of medications. For me, one of the most important components of her treatment is the pain medication. Kittens are masterful at hiding pain, and humans are honestly not very masterful at perceiving signs of pain in cats and kittens. So these are all of Rhubarb's medications. She has 3 different eye drops. She has ofloxacin, she has terramycin, and then she has a serum donated by a dog. Thank you, Nico. She gets 1 little drop, and
and then the rest of it goes back into the fridge. Aside from that, she has her doxycycline, which is an oral antibiotic. She has her famciclovir tablets, which are an antiviral. She gets a quarter tab, so here's her quarter tab, and then I actually take that quarter tab, break it up even smaller into tiny pieces, which I give her sneakily with a churu. Last but certainly not least, buprenorphine. This is just a small amount of oral buprenorphine that goes into her cheek pad to help with pain. The eye drops are given throughout the day, but I only do one at a time. So for the morning, this is what she's going to get. So first things first, we're gonna get this buprenorphine. And then while that does its thing, I'm gonna do my serum drop. Boop, good job. A little bit left over, I do put a little bit into the ruptured eye. Doxycycline. Now for the fun part, and this is a part that I think she's starting to figure out, is that with her morning meds, she gets her churu. So I give her a little bit of treat. Then I'm gonna try to sneak the pills in there. So often I'm able to do this without her even noticing. Nice. Didn't even notice.
So what is the plan with you, little girl? What are we going to do? Rhubarb doesn't even weigh 1 pound yet, and so we want to get a little bit more weight on her before we do that surgery. With a kitten with a ruptured eye like this, we're kind of balancing these two factors. One is that we want to have them be big enough to safely operate on, and we want them to be healthy enough to make it through surgery, but then we also want to not leave a ruptured eye in so long that it can become infected. When a kitten's eye is ruptured, it really invites a lot of bacteria into the body, and we know that sepsis is one of the primary causes of death for kittens. We are always trying to balance these factors. You know, if something changes and she develops significantly worsened symptoms with that eye, it would be something where we would need to operate right away. So we've got a great vet lined up, and as long as she stays stable, we're hoping to do surgery in probably about 10 days. I'm hoping also by then it'll be clear whether we need to do a double enucleation or just operate on the one eye. I have to share that, you know, I did have a couple comments online of people saying, oh, it's so mean to keep her alive, you should euthanize her, how can you let someone live like that? And I just totally disagree with that. I've cared for dozens and dozens of kittens with eye infections. If you've followed me for a long time, you probably remember my cat Eloise, who lived a beautiful life for 11 years, and she had only one eye. Her life was beautiful and meaningful, and she definitely didn't need to have it cut short just because of an eye infection when she was a kitten. In fact, when I first rescued her, she looked a lot like Rhubarb. So we don't know if Rhubarb will have any vision, but really the goal is just what is the best we can do for her. Even if she loses both of her eyes, she's going to have a wonderful life. And if you don't believe me, you should go to my website to learn all about blind cats and kittens. I mean, eyes are helpful, but you don't have to have them. You know, it makes me sad to think that anybody out there would think that Rhubarb is not worth saving. She absolutely is. Whether you have one eye, whether you have no eyes, whatever it is, life is only gonna get better from here. Eye infections are one of the most common medical issues we see in kittens, and my nonprofit Orphan Kitten Club actually gets more requests for kitten enucleation surgery than anything else. In fact, we just hit our 100th enucleation. So when you donate to Orphan Kitten Club, you're actually supporting kittens all across the United States, just like Rhubarb. Because enucleation surgeries are the #1 request we get, we decided we wanted to do something more for these kittens and actually investigate possible treatments that could help them to save their eyes. So I'm very proud that Orphan Kitten Club actually helped to fund a study at UC Davis. In this study, kittens who came into animal shelters with significant eye infections were able to enroll in this research. And they were either given the standard treatment with antibiotics, or they were given the antibiotics plus an antiviral drug called famciclovir. The study was just published a couple months ago, and the findings are phenomenal. This study found that kittens who received famciclovir in addition to doxycycline were able to recover 4 to 5 days faster, and they had less corneal disease. So that is a huge win for kittens, and it's something we can already take and put into practice with kittens like Rhubarb. Kittens like Rhubarb deserve to have the care that they need. If you agree with me, you can actually contribute towards her surgery and to help other kittens with eye issues like her at orphankittenclub.org/donate. Thanks for watching, and we'll update you soon. Bye-bye!